Peptest is the first test available which will help us to gain a much clearer understanding of this entity, what we call extraesophageal reflux. Let me just tell you conceptually how this comes about. Today we recognize gastroesophageal reflux very well, forgetting it's taken about 20-25 years of development to get an understanding, which amongst other things showed that every healthy person refluxes, small amounts, fleetingly, mainly after meals, and get no symptoms. Disease is when the reflux is excessive and causes symptoms. If you take the question of extraesophageal reflux, which is a very complex area of which we are just beginning to get to grips with, we were initially hampered by lack of a true measure. There was no real means by which you can prove that reflux had gone beyond the esophagus up into the throat and from there spread elsewhere. But tantalizing clues came up, and one of them was some of the wonderful work which showed the stuff, pepsin, in the middle ear of children who had otitis media. Where the Peptest comes into real benefit is, this is it. This is it. Think of a screwdriver, what a useful instrument it is, enshrining great thought. Pretty much this way, because this suddenly allows one to get a true measure that pepsin has reached into the extraesophageal areas, the first test which reliably actually detects this. So if one can show that pepsin is present frequently and in excess, far more than in normal subjects, you're on to a definite clue as to what might be causing the disease. Patients right now cannot make an informed judgment other than any non-invasive test is better for them than an invasive one. So that's a definite plus. They are perfectly happy with having multiple samples. It's not that much of an inconvenience. It's considerably better than having invasive studies being carried out. If a patient's pep test is consistently positive, then I know that pepsin is likely to be playing a significant part in the person's condition, as opposed to someone with similar symptoms but with negative tests. In the very long run, I would guess it would turn out to be as the story of acid suppression showed. Once you have drugs that actually deal with the patient's direct problem, if you could, for example, take care of pepsin, we've got enough for acid already, if you could take care of pepsin, then the patients will gain very considerable benefit. In the long run, I expect this test to be rolled out to respiratory disease, and the group who I mentioned earlier is to explore its use in children with chronic recurrent otitis media who are left with lifelong damage to their hearing. It's time we started to get a grip on that.